Hi folks, this is Dr. Rob CYWES. I am a practicing clinical physician and a surgeon. So I am a doctor and I see patients every day. And I get a lot of interactions from patients. I get a lot of consults as a second opinion from people on a ketogenic or a carnivore lifestyle who find their interaction with their own personal doctor, endocrinologist or PCP or whoever, cardiologist, to be a very traumatic visit based upon that doctor's personality and perspective in their role as a physician. And I just thought I'd give you a couple of comments from my perspective as how I handle things. So the first most important thing that we doctors have to accept is that every single one of our patients, the only thing I can guarantee you, every single one of our patients is going to die. My job as a physician is to help people to understand or have the information so that they can decide how best they're going to live a healthy life and how best they're going to live as long as they can, but it is not my decision. My objective is to provide them the information and the mechanism, but not to force them to do anything. It is always a patient's choice. It is always the patient's choice. And all too often, doctors are highly pedantic about you must do this and you have to do this. And if the patient says, no, I've got a different idea, doctors often get very, very upset that a patient is non-compliant. Non-compliance is a choice, and we physicians have to accept that. So when it comes to prescribing statins, for example, oh, you're going to die, you must take a statin. Don't argue with your doctor. Try to have a conversation and ask them, perhaps, why is it important? What are the risks of not taking it? Get their opinion. And then if you're not certain, get the opinion of somebody else like myself, and the two opinions will oppose themselves. And then you decide what you're going to do for yourself because it's your decision. As long as you don't hold the doctor liable one way or the other, you make the informed decision. So it is important to have that understanding with your doctor, that you're there for information, you're there for their guidance and their help, but it should not be autocratic. At the same time, and this is such an important concept for me, always ask your doctor if you can record your consultation. In fact, I encourage my patients to record their consultation. And if you look at the show notes below here, it says that. Why? Because I want the patients to remember the context of our conversation. We only remember a very small amount because we're intimidated a little bit by the white coat, we're a little afraid, or we're thinking about other things. It is always useful to go back and listen over and over and over to that conversation. But remember, your doctor is human. They're not perfect. And sometimes they say things that's incorrect or wrong, or sometimes we just don't know. So as you re-listen to that conversation, don't accuse your doctor of being an idiot or stupid or not knowing, or go back and revisit some of those things. Sometimes I'm wrong. Sometimes I make mistakes. I shouldn't be condemned for them. And if you've got a recording and if you ask questions, it's absolutely fine because you deserve the best answer I can give, but you also deserve me saying, you know what? That's beyond the scope of what I do. That's beyond the scope of my knowledge. I can read up about it, but I right now do not know the answer to that. Sometimes doctors struggle with that, and they'll give you an answer that may be incorrect or partial because they struggle with the concept that it's okay not to know. But ask to record the conversation. Ask to record the consult. Make sure you tell them that you're recording it. But I encourage my patients to record the conversation so that we can discuss things further. And if I'm wrong, or if I made a mistake, or if I need to flesh something out, that's the value of our relationship. And doctors fear lawsuits. Doctors fear lawsuits. This is kind of a disclaimer. I'm not always right. I don't always know. But together we can work this out if we have a good relationship. It is incumbent upon you to understand and be empathetic to where your doctor is coming from and help them to be better, a better partner in your relationship with them. And you know what? If they're not capable of doing that, as Brene Brown says, if you've tried and they're not capable of doing that, then move the rock. But don't confront them, don't accuse them, don't challenge them in their level of expertise. Try to find a comfortable way for working with them. Just like a good doctor should make you feel comfortable. It sounds odd, but a good patient should make their doctor feel comfortable. You're going to get the best from them. I hope this helps because I see that conflict so much. How to talk to your doctor is so, so important. I hope this helps. I am the Carb Addiction Doc. Listen to this again and again. It is recorded. Till next time.